20,000 jobs are being cut across critical public health agencies. The FDA losing 3,500 jobs. These are the people responsible for ensuring our food, medicine, and medical devices are safe. The CDC losing 2,400 jobs, which means fewer resources to track and control disease outbreaks. The NIH losing 1,200 jobs, delaying life-saving medical research. And CMS, Medicare and Medicaid Services, losing 300 jobs, which will slow down services for millions of Americans who rely on health care assistance. And that's just the beginning. This government is restructuring HHS into a new entity called the Administration for a Healthy America. But many experts say this is just a way to shrink the federal government and weaken public health protections. So, why is this happening? This newly appointed secretary, Robert F. Kennedy Jr., says this is about efficiency and cutting down waste. But let's be real, how does gutting the agencies responsible for pandemic response, vaccine oversight, and healthcare regulations make anyone safer? These cuts aren't just numbers on a spreadsheet. They have real-world consequences for all of us. Fewer FDA inspectors. This equals more risk of unsafe food and drugs reaching the public. A weakened CDC equals slower response times to deadly outbreaks and public health threats, like measles. Fewer NIH researchers equals delayed progress on cancer treatments, autoimmune disease research, and other life-saving medical breakthroughs. Less oversight at Medicare and Medicaid equals more barriers to healthcare access for vulnerable populations. And here's the kicker to all of this. These layoffs come right after the one that's in the White House revoked collective bargaining rights for federal workers. That means those that are being fired have even less power to fight back. Coincidence? Or a calculated move to weaken public health agencies from the inside? The question is this really about efficiency, or are we watching public health get dismantled in real time? What do you think? Are these cuts justified, or are they putting all of us at risk? Are losing these jobs justified? Drop your thoughts below and let's talk.
Definitely, because that's our health. Why would you, out of all departments, why would you go and mess with the health? I seen a video that I'm gonna play. Well, a man say the food from the FDA, the quality is gonna go bad, and it was already bad.
R&D engine that is the United States, and therefore a significant negative impact on the economy, as well as the health and well-being of our citizens going forward. I will keep you updated here. Follow for more.
The mood is somber at HHS headquarters in Southwest D.C. Employees quickly walking into the office complex to learn if they have jobs. None of the employees wanted to talk to reporters, but one man told me as he entered the building some of the managers last night did get the word how deep they'll have to cut staff, and those decisions, he said, are being carried out now. Another man who I spoke with briefly said, "We haven't been told anything. We are completely in the dark." HHS Secretary Robert F. Kennedy Jr. has said he wants to cut the department by 30%, eliminating 20,000 positions through terminations, retirements, and resignations. At HHS headquarters in Southwest D.C.
Wow. 20,000 people don't know what they go do now, and they want to force you to retire. Just turn in your 2-week notice, or we just gonna let you go. 1, 2 of the 3 gonna happen. So this is so sad. This gonna affect so many people. Now we already got Southwest laying off 1,800 people, 1,800, and we got GM in the last 2 years did over 3,000, and now we got the U.S. Department government jobs. They hit with 85,000, and then now we got the U.S. Health Department, 20,000.
There. We oversee federally funded child care, child support enforcement. These are the services that serve the taxpayer. and they are gone. The people who administer these programs are gone. So I don't think the regular taxpayer understands how government works and how these services actually serve them until they don't get their Social Security payment, they don't get their SNAP, they don't get their welfare check. Then they will see how these RIFs will impact them. Right now, it's this kind of, oh, someone else. It will impact all of you.
So we all know the dude. When he talks, he sounds like he's got a garbage disposal in his throat. I'm sorry, I shouldn't mock. Anyway, we all know that he is now over the Department of Health and Services, right? The dude with the brain worms who eats roadkill. Okay, just so we're all clear on who I'm talking about. So today, he basically gutted the Department of Health today. So I'm going to read this because I want to make sure I get it right. So 3,500 employees at the Food and Drug Administration, gone. 2,400 employees at the Center for Disease Control and Prevention, gone. 1,200 employees from the National Institute of Health, gone. And 300 employees at Medicare and Medicaid services, gone. I believe we have now entered the Hunger Games phase of this administration. We are now in the survival of the fittest. I truly believe that these people are thinking that, if you are wealthy and you can afford to buy the medicine, you will. And if you can afford to buy organic food or whatever, you'll be okay. It's the people who can't afford those things, right? Because we know he's already rolled back the cap that Uncle Joe put on insulin and other medications. So I truly believe that we're at the point where if you can't afford to buy your medicine, they just expect you to die, right? They just expect you to die. So I just got back from walking and exercising, and I had a low carb meal and chicken and broccoli, high protein and fiber, because I plan on living, but I'm just saying.
Health Secretary Robert F. Kennedy Jr. telling ABC News some of the 10,000 people who were fired were cut by mistake.
There were a number of instances where studies that should not have been cut were cut, and we've reinstated them. Personnel that should not have been cut were cut. We're reinstating them, and that was always the plan.
Health and Human Services not only provides health information to the public, but also helps fight diseases and provides desperately needed research on vaccines and medical treatment. The agency began laying off thousands of workers on Monday, shuttering whole divisions. The top scientists monitoring the bird flu, gone. The official who led the program that cut teen tobacco use in half, gone too. ABC News reporter Cheyenne Haslett asked Kennedy why the department had cut a CDC program that monitors lead levels in children. The same program that uncovered the lead in applesauce pouches in 2023.
Can you explain the rationale for cutting a program like that and why that's not an essential service?
There were some programs that were cuts that are being reinstated, and I believe that that's one of them.
Those comments catching the director of that program by surprise.
Without us, there is no other unit at the federal level that is here to support them in doing what they need to do.
But overnight, an HHS official telling ABC News that the program, how it exists now, will not be reinstated, saying the work will still continue elsewhere at HHS.
So y'all made a mistake and fired the wrong people. Are you kidding me? I'm glad y'all got y'all job back, the ones that did, but y'all doing all of that, y'all doing a bunch of F-ups, stressing people out. That don't make no sense.
10,000 public employees at the Department of Health and Human Services, public employees who are dedicated to our health and safety, have been fired. Thousands from the FDA. Will food safety get better or worse?
The people who make sure our food's safe by inspecting it, by running labs, by looking for pathogens, by alerting industry when pathogens are present, by alerting us when pathogens are present, all of those people were likely fired today.
So with that in mind, is food safety going to get better or worse?
Much worse.
Baby formula, safer, less safe.
Less safe.
The approval of over-the-counter drugs, is that going to be slower or faster?
Much slower.
Medical devices, the approval of those devices slower or faster?
Much slower.
The safety of those medical devices?
Less safe.
Consumer choice, is that going to go up or down?
Consumers will have fewer choices and will be taking more risks.
Innovation in the United States, especially in the context of food, drugs, medical devices, innovation, is it going up or down because of these firings?
All of the companies that are sitting here before you with innovative new products will have to wait longer to offer them to our consumers.
If there are fewer products and fewer people checking to see the safety of those projects, determine the safety of those projects, higher prices, less safety. Is that fair?
Fewer products, riskier products.
And those prices will most likely go up.
For many reasons, yes.
And those products will be less safe.
We weren't providing enough oversight yesterday. They will be more dangerous because of the decisions that were announced today.
That's the world we're living in. And I yield back.
So we're gonna sit right here and pay more for unsafe products. We're paying more for stuff that might have lead in it. We paying more for a big issue, and everybody's finna get ready to pay. This is finna affect all of us. So we all about to pay a price. Let me know down in the comments what you feel about this. I'm Tiffany Rose. I'm out.